Great. Daniela, can you add Dr. Karpiak to the panelists because I see her in attendees?
Yeah, absolutely.
Okay, great. Good morning, everyone. It is 8:04 a.m. on February 28th, 2023. We're going to call the Board of Health meeting to order. My name is Deanna Diamore. I'm the Director of Health for the City of Norwalk. We are joined by board members Terry Quell, Joan McNeil, Norman Weinberger, and Janet Karpiak will be joining us in just one second. We also have city staff, Health Department staff, Daniela Fignon, Megan Fogno, and Brian Weeks. So good morning, everyone. The first item on the agenda is the approval of the January 24th, 2023 meeting minutes. Do I have a motion?
Motion to approve.
Okay, Dr. Weinberger motion, Terry seconded. Any discussion? Any comments? All right, all those in favor, say aye.
Aye.
All those opposed? Any abstentions? Motion carries. Thank you. Good morning, Dr. Karpiak. All right, so the next item on the agenda is the director's report. And so I just want to share a couple updates. It's budget season, so the budget is going through, its normal processes. Just wanted to report that the mayor's recommended budget has everything that we had requested. It wasn't that many. Most of the cost increases were salary, increases based on step progressions and those type of things that are in contract. So those are most of the increases, but we did put an increase for a little bit more for relocation costs based on the increasing costs we've seen over the previous years related when we've needed to have relocation. And you'll probably recall that relocation is related to if there's a code enforcement activity where we deem an apartment or housing uninhabitable, the city is responsible for relocation costs. So we've had more of those situations and incidents over the past couple of years. So we've needed a larger budget for that. And then we also have just had some increase requests for some office supply line items as our staff has grown, our office supplies and it has increased slightly. So those are the main highlights for our operating budget. Any questions on the operating budget? Any discussion? All right. We also, in terms of other updates from me, you all know that I am in DC this week for a conference with the National Association of County and City Health Officials meeting with other states, and it's been going really well and getting a lot of great information from other states and learning about, great best practices. And so that'll support both Norwalk and Connecticut as a whole. So I'm going to be sharing some of those great materials with everyone. So that's been great. And we also have some personnel updates. We're still in the process of interviewing for the receptionist position. So hoping to wrap up some of those interviews soon and have be able to fill that position. We've had our public health nurse, Corey, come back. So she's joined the team again. So that's been great. And then we're also going to we're looking to bring on an additional advanced practice provider. And so we're going to have to be reposting that position soon. It's always been a challenge to find clinical support. As you all know, the job market out there is tough. There's a lot of, competition with hospitals and others. So going to be looking to bring more staffing support for our clinical services. I think those are my updates. Any questions? Okay. Sorry, one more thing I just wanted to share. We were selected to participate in a Strategic Scholars Program. I want to thank Daniela for working on putting on an application together. This is a program with the National Network of Public Health Institutes. They select cohorts across the country to participate in projects. This year's focus is on resource management. And so we have 5 staff members participating. We have Megan, Brian, Darlene, Daniela, and myself. So we're going to be able to have access to a financial training for free. We're going to have access to consultants who are going to help us for free. We're going to have access to conferences and trainings, all covered through the program. And so I want to thank everyone who's participating who put together a really great application. We're going to be focusing on looking at our clinical services and doing an evaluation of, what kind of revenues are we bringing in, how are we sustaining the program, and we're going to be relying on a lot of these consultants to help us shape this and give us some guidance on that. So it's going to be a quality improvement project. So just wanted to share that with you all. So we're really excited to do this. We were selected back in 2020 to participate in a project. Teresa and I participated, but with the pandemic, it was really challenging to be able to participate, obviously. So we're excited to have a second go around at this. Aniela, is there anything you wanted to add to that?
No, I just wanted to say, thank you to Deanna for letting me apply, and I'm really excited to kind of get all of the good bits and pieces out of the cohort.
Great, thank you, Aniela. Aniela, I see that Ken is also here, but in attendee mode. Would you be able to promote him to panelist?
I just promoted him.
Perfect. All right. Good morning, Ken. Ken has joined the meeting at 8:10 a.m. All right. So the next item on the agenda is a strategic planning update. So I have some slides that I want to share just to recap where we've been and where we are now. So if you give me a second, I am going to attempt to share my screen. I'm going to go in presentation mode. Can you all see it in slide mode? Does that work? All right. So as you recall, we've updated our vision statement, healthy Norwalkers thriving in our vibrant community. We've also looked at our mission statement, but we felt that it was still very true and didn't need any updates. So we're going to keep our mission statement. We've updated our value statements to add health equity. So you can see the in the color. So we updated to our values to include health equity, to value our status as a nationally accredited health department, to add transparency, to add community trust, and then looking at our workforce to not only include our staff, but our volunteers and the future public health workforce. We put together this word cloud that Megan and Aniela put together with a team of staff to look at, what are great words to that embody the health department and our vision for the health department, to include these within communications materials. Terry had some feedback for us on some of the positions of the wording, so we updated this. So this is the latest. We put prevention right under our healthy Norwalkers to make it very apparent that that's a core to what we do. We move transparency up to the top. All right, I got a thumbs up from Terry. Good. Okay, thank you for that feedback. That was really great. So if anybody else has any other thoughts, let me know and we can update that as well. But we're liking what this looks like. So thanks, Terry, for that feedback. So as you all remember, we had work groups, we met, and we talked about, what are our strategic priorities. And so we landed on workforce development, community awareness and trust, evaluation of programs and services, foundational infrastructure improvements, technology. I just want to repeat that this was based on, a very comprehensive environmental scan of data, a survey that went out to the community, looking at all national reports on the future of public health, looking at where we are within Norwalk and data, specific to our community. So this was, a whole process to get us to this point. And we also wanted to make sure we had health equity and climate change addressed, and we decided to look for ways we could interweave and embed that throughout the different priorities in the strategic plan work plan. These are our goal statements. We've already shared these before, but as you can see, they align with the strategic priorities. And then some of the new content. So I distributed draft work plans to the board so they could see that. And want to get feedback on that as we finalize that. But to summarize, workforce development will include objectives and activities related to updating our work and implementing our workforce development plan, focus on recruitment of a qualified and diverse workforce. There's some activities in this objective that relate to looking at things through a diversity, equity, and inclusion lens. Now that the city has a diversity, equity, inclusion officer, we want to consult with her and get her input on our efforts. We also want to collaborate even more with community groups and community organizations to help us recruit and hire. And then also continuing our partnerships with academic institutions. As you know, we have agreements with several universities, and so continue to offer those opportunities to also help with promoting, public health as a great career choice and working at the health department, specifically ours. Onboarding is also included in this, updating our new employee orientation, putting together, a whole toolkit, which is already underway. Looking at a supportive work environment. As you remember, we talked about the mental health of the current public health workforce and, all of the, based on the pandemic, all of the issues and all the things they were confronted with and having to face. And so, building out a supportive work environment policy, and thinking about the mental health wellness of our workforce. And then also making sure that we have climate and health equity trainings included within these efforts. For community awareness and trust, there's an objective related to communication and making sure our materials are translated into the languages that are most frequently spoken in our community, including Spanish and Haitian Creole and English. Also, making sure they're culturally relevant and appropriate, our materials, and looking at what's the budget for ensuring that. There's a whole section related to community engagement and fostering further relationships with the community and offering consistent feedback loops where we can get feedback and onto our programs and services. And also just visibility within the community, within Greater Norwalk, to what the health department is doing and what we're offering. Evaluation and services. This is really focused on programs and services. At first we had put together, let's look at all of our programs and services and do evaluations for everything, but it's a 2-year plan. So at least this part of the work plan that we're fleshing out. So we really wanted to focus here. So first part of this is really looking at partnerships and looking at what we're currently doing and where we could be developing new partnerships and expanding partnerships to meet, the community need and to help us within our own operations. How can we reach the community more and continue to expand? So through partnerships, and then in particular focus on our clinical programs and services, with our offerings, our travel and adult immunization clinic, where are we now versus where we were in the past? What does the market look like? Where should we be focusing on? Thinking about our sexual health clinic as well, what is the need? There's a great demand for that. And so how can we look to expand that and also bring in additional revenue to support that clinic? The fourth priority area is foundational infrastructure improvement. So these are the things that look at, what is necessary to have a fully functioning local health department. And so accreditation is a big part of that. Quality improvement, getting back into having our quality improvement work group meetings, our plan and our focus with for quality improvement. Our community health improvement plan, updating that and making sure that we're, evaluating our efforts there. Looking at our grants organization, we've created a new electronic filing system to make efficiencies and improvements there. Consistently looking at our policies and plans and revisions and updates. Also offering more opportunities for peer sharing and learning within our department, so everyone is aware of what's going on in different divisions and programs. And that also leads to quality improvement, right? Like communication, teamwork, collaboration, that's part of a quality improvement infrastructure and culture. And then, of course, climate change and thinking about like how can we position ourselves to work with others and what other what opportunities are there for us to be a health department that can be a leader in this area. And then lastly, technology, really looking at our security and confidentiality of our information. We want to explore establishing, HIPAA hybrid policy, and working with the consultant for that, making sure we have user-friendly applications and solutions within the department. And we've talked about, making improvements to our mental health software system. We want to look at our financial system, and then health informatics and public data, expanding upon the work that Brian's already begun with the COVID-19 data hub, and looking at other areas that we can be sharing more and more data, and then utilizing software systems to help us with our decisions, and interfacing more with the public with surveys and other components like that. So that is the update. I'm going to stop sharing the screen so I can see you all. Does anyone have any thoughts, or feedback, comments about all of that? Questions?
It looks great, very comprehensive. I think you and the staff have done a great job. It's a lot of work.
Thank you, Terry. Anything else? I don't know if Aniela or Megan or Brian, if you have anything you want to add, because you were big participants in the strategic plan, but open it to you guys too if you have anything you want to add. If I missed anything. All right, so we're going to be finalizing this and be posting it soon, but we're going to continue to work through and make some improvements. But in the meantime, if there's anything you notice, any thoughts, please send them to me, and we'll incorporate them. Great. Thanks, everyone. Again, really want to thank Aniela and Megan for their leadership in the strategic plan too. They were part of, the whole planning work group for this. And Brian was one of the leads in our work group. So we had other supervisors leading and staff. So it was a great involvement of everybody. Okay. Going to pass it now to Brian to give an update on some epidemiology updates. Good morning, Brian.
Hey, good morning, everybody. Yeah, I was going to say you covered everything, so that was great. So switching over to kind of just a general update, it should be pretty simple because everything's kind of in a good spot at the moment. Let me just share a screen and we'll jump right into it. All right, so you guys should be seeing the COVID data hub loading in shortly. So just kind of dropping down to the kind of the CDC COVID-19 community levels, again, low, medium, high, 3-tiered system. As you can see, Fairfield County is in the low. Woohoo. And so we've been here for just 2 weeks now, and it's really great news. So again, this is in terms of COVID, but nonetheless, the respiratory illness kind of situation overall is still pretty good. Although obviously we got a little bit of the winter kind of striking back, so to speak. So we'll see what sort of impact it does have in terms of the community, because naturally, obviously, the temperatures drop as a result. And then people have to stay indoors. So there's also that consideration. So I'll still kind of remind everybody what the recommendations are in regards to that. Staying up to date with obviously the COVID-19 vaccines, maintaining ventilation as best as one can in the indoor public settings, avoiding contact with people who have suspected or confirmed COVID-19, obviously following the recommendations for isolation. If you have suspected or confirmed COVID-19, follow the recommendations in general if you are exposed as well. And then also if you're high risk of getting sick, talk to your healthcare provider about additional prevention actions. But with that said, and here's kind of the data story. I mean, if you even look at just the case rates and the percent positivity for the big 7 Connecticut cities, you can see how low we are. It's really phenomenal. So this most recent data of February 27th, you can see Norwalk at a case rate in the last 7 days at 22.52 per 100,000. And so really great news. And as you can see, the highest right now is actually Bridgeport with 40.17. But also New Haven and Stanford kind of close to one another, at 31.48 and 32.4, respectively, in terms of the case rates. But again, as we kind of are well aware, there's a gray area there, a very large one in terms of at-home testing that's not accounted for there. So then looking at more of the measures that would be a better reflection of what's going on, the COVID-associated hospitalizations for the state of Connecticut. Again, you can see where we were with even the peak of this year. Back in January at 779, technically at the highest. But right now, with the most recent data that's been available, it's a couple of days old, but we were below 300, and it's been a very steady decrease at the 298 in Fairfield County in third place in terms of presenting with the number of COVID-associated hospitalizations. Nonetheless, as you can see here, we have very steady decline, but you do see some hesitation here. So we're looking forward to the future data points just to see where we're at. But it kind of looks like things are kind of steadying a little bit in terms of the COVID hospitalizations for the state. So it's kind of going back to somewhat background levels relative to Omicron. As you can see, what we were experiencing even during the summer and fall time of last year. And so it kind of is a little bit of an interesting thing, as opposed to having like that dip we had with even like.
I think Brian got dropped.
Yeah, he's been dropped.
Okay. All right, let's wait and see if he's able to join back. But in the meantime, Aniela, can we move on? And can you give us a quality improvement update?
Absolutely. So as you all know, we are getting back to some of our regular activities at the health department, including our quality improvement efforts, which are really kind of broken down into 3 buckets, which is, working on and revising our quality improvement plan, reinvigorating our quality improvement work group, which works on quality improvement projects throughout the department, and also beginning or recommencing our quality improvement trainings for all of our new hires. So we are actually going back retroactively and ensuring that everybody who was onboarded during COVID gets another quality improvement training. Just to make sure we're all on the same page and all get that experience of having some hands-on QI training. We are also, back to having a work group. So that's really exciting. We had our first meeting in February, and we all got together and decided that our next steps would be to revise the QI plan and to take a look at kind of where we are in terms of our QI culture. So that is what's going on the QI front, and really excited to be doing the work.
Thanks, Aniela. Any questions about QI? Aniela's doing a great job. She made very interactive QI training, made some updates to it based on, what Megan and I have done in the past, but so excited to have that going again. Brian, all right, I see that you're back. Are you able to jump back in?
Yeah, so I might not be able to pull visuals because I am actually joining by my phone. I'm trying to get my laptop to reconnect. Apologize about the internet connection issue. Seems like you got a little bit bored with my update, but I can kind of just go over it, verbally. So I'm not too sure where it stopped off, but I'll just say again, we're below 300 right now. We're still waiting for some newer data points and just kind of see the impact of this winter weather in terms of the COVID-associated hospitalizations for state, and especially obviously Fairfield County. But we're in a good spot in terms of the wastewater monitoring, as you could, as I'm seeing. But hopefully the connection kind of fixes itself in the laptop. But it's a downward trend. It's a continual one over the weeks, so it's another good thing, and it's kind of going to almost background levels of where we were back in 2022. So that's also kind of a very solid thing as well. And again, I think it's just evidence that, fortunately, with all the recent mutations of the Omicron variant, even the one that was initially in the news out of concern that it might be potentially more infectious and more concerning, CH.11, that has not picked up. It's actually been very steady over the weeks in terms of and very low in terms of presenting proportion of new cases of COVID. So overall, it's still the XBB.1.5 show. Again, you can't see the visual right now, but pretty much the majority of the country is, at minimum, almost like 2/3 of XBB.1.5, including the West Coast and the Pacific Northwest. Which was, last time we presented, not there yet. So it's still slowly gaining ground, but it's definitely the dominant strain of COVID-19 at the moment. Also, I want to step back and just say for the state of Connecticut, in terms of the CDC COVID-19 community levels, Fairfield County and New London County are the two in the low, and then all the other counties, all the other 6 counties are in medium right now still. So that's something else to consider as well. But still, the trends are very good at the moment. In terms of influenza, kind of same story. It's still hanging in low background levels, compared to some of the other seasons as well. But still something we got to keep an eye out for. It's still occurring to some degree. And we still anticipate potentially, type B kind of, presenting at some point during the season. If not, it might not. So we'll see, but it's something else to kind of consider that has the potential to rear its head. And then, in terms of flu, nationally speaking, New York City and unfortunately DC, as well as Puerto Rico and even New Mexico still have high influenza like illness activity. So it's something else to consider. And even California, it's kind of moderate. So these are other popular kind of places to kind of consider as well in terms of activity. But fortunately, Connecticut's still considered in what would be like the low activity. So that's very good for that. RSV, it's still basically at background and normal levels like it usually is, with the exception, obviously, of the unique and historical highs that we had back in the earlier part of the winter season in late fall. So overall, again, you can't see the visual because I'm connected by my phone, but in terms of the big three, so influenza, RSV, and COVID-19 still kind of maintaining those weekly emergency department visits. It's a nice graphic that the CDC does provide, because influenza and RSV are kind of at normal or acceptable levels, so to speak. And so it's really up to COVID-19 or SARS-CoV-2, the virus that causes it, in terms of where things go. But at least, with the newer subvariants that, we're kind of concerned, like CH11, that's not something that's quite applicable at the moment. So good news overall. Jen, we just want to get out of this wintertime further unscathed. So something else we still need to be mindful of these prevention measures that were outlined earlier. But we're in a good spot. So great news to share. So thanks, y'all.
Thank you, Brian. Thanks for that great update, and appreciate you being flexible and adjusting and joining by phone. But it still is really good and great information. Anybody have any questions for Brian? All right. The last item on the agenda is public participation, but I don't see anybody who is attending. So don't think we're gonna have public participation this morning. All right. So then let's motion to adjourn, wrap up at 8:31.
So moved.
I'll move by Dr. Converge, seconded by Terry. All right, all in favor? We're gonna. All right. Thank you, everyone. Have a great day today. Stay
Thank
safe
you.
out there.
Thank you. Enjoy the conference.
Thank you. Enjoy the snow.
Okay,
Well, thanks.
okay.